Sorry, I almost tripped you.
Good.
Hello and welcome to Around Town TV. My name is Carla Berline and I am so excited to have with me tonight Dr. Joe Biernat, who's going to be talking to you about stem cell therapy and treatment. So if you're somebody who suffers with pain in joints and or all parts of your body, you want to stay tuned. Or if you know of somebody who suffers from pain, you're going to want to stay tuned. I love having Joe on the show because I've known Joe since, gosh, you were 8, I think?
8 or 10.
8
yeah.
or 10 years
Long
old
time.
when he started playing hockey with my brother. And I know his character, I know his integrity, and one thing about Dr. Joe is he is the best at everything he does. After being an incredible hockey player and going on to school, he also played professional baseball for the Cubs, and then he also played for the Saints on both championship teams, or when they won 2 championships. So he's always been very good at what he does. He understands athletes. He understands health issues. You've been about health and wellness. So welcome to the show. We're just so thrilled to have you here.
Thanks for having me. Appreciate
You
it.
bet. So why don't, I think a big thing that a lot of people are going to be wondering about before we get into the whole stem cell thing is Minnesota Joint and Spine. What is it? Tell us a little bit about how this is involved.
So we're just basically rebranding our clinic. We used to be Specific Family Chiropractic, which has been around almost 20 years now. And we're just changing things up a little bit, kind of rebranding ourselves to be more inclusive of the treatments that we do. We're not only a chiropractic clinic, but we do massage. Obviously now we have been doing stem cell now for a few years, so we're just kind of expanding into more of a overall joint and spine clinic, and the name kind of encompasses that. So we're just kind of a rebranding, not losing our old identity,
Right, just adding
to
expanding.
It. Correct.
Well, and I have been a patient of Joe's when I was in a very, very bad car accident. And I was actually ended up doing pretty well, but I had soft tissue damage, which Joe had explained some things to me. And then we had a family friend who went to Joe who had been to specialists on other things, and he just gets it. He understands. And so it doesn't surprise me that you're now evolving into this brand. And if you're tuning in or you have questions, please ask online. We're going to take your questions live tonight.
Yep.
We'll answer as many as we can. If you don't feel comfortable posting or sharing your pain stories or asking those questions, you'd prefer to private message either Joe or I, please do so. We will get back to you. I'll let Joe know immediately if someone reached out to me privately as well. So, but getting back into what you're doing, what is stem cell therapy?
So stem cell therapy is it's kind of the newest thing in healthcare. So stem cells are cells that they're undifferentiated. And what that means is they haven't changed into what they're ultimately going to become. So a stem cell can literally become anything. It became muscle, ligament, tendon, it can become a nerve. So stem cells have some unique qualities. They have the ability to divide over and over to create new tissue. They can also change into other types of cells. They just need direction. So when they get to an injury site, the body will tell them, you become a muscle, you become a nerve. So it's the way our body heals itself. So as we age, we obviously become less and less efficient at that.
Yes.
So when we have an injured area or as we begin to age, stem cell therapy is a way that we can stimulate that healing, that repair process in the body.
Oh.
And stem cells also have another ability, it's called the paracrine signaling effect. So I explain the paracrine effect to patients like if you were to walk into the middle of a field that's got dry grass, and if you were to drop a match, that flame is going to spread out from a center. When you inject some stem cells into someone, you'll get the replication of the stem cells themselves, but they are also going to activate your own cells around that area to act in a similar way and to help that healing process, and that's what they call the paracrine signaling effect. So they have a very, very high capability to help the body heal and repair itself.
Interesting. Well, and you know, I have heard of stem cells even during elections. You know, a few people would play that or
Sure.
mention it. But this isn't something new, right? This is
Nope.
something that's been around a long time.
Stem cells have been around a long time. There's, you know, history of it going back to the 30s where they would transplant bone marrow into cancer patients. The first successful bone marrow transplant was back in 1968. They had a couple of siblings that were had severe immunodeficiency syndrome, and they transplanted some bone marrow into them successfully.
Oh, wow. I want to say hi to those who are tuning in. John, Terry, Deb, Bick, Todd, thank you for tuning in. I have Dr. Joe Biernat here with me, and he is talking to us a little bit about, well, a lot of it about stem cell treatment and therapy. If you're somebody who suffers from pain in joints in your back and things like that, you're going to want to stay tuned. Feel free to ask questions. We did get one question already,
Sure,
and then we'll jump back into, a few of you sent them ahead of time, so I'll get back into those. Is it true the purpose of the spine is to support the neck, the head, and the doctor of chiropractic?
So the spine's job is to help protect the brain, the spinal cord, and all of our nerves, and also provide a rigid structure for the body to help support our tissues.
Okay, yeah, no, that makes sense. So, and I know we were talking about, I kind of asked a couple questions together, my own of what is stem cell therapy, but do you want to get into a little bit, or have you already sort of explained this on what are stem cells?
So we've kind of covered what they are.
Yep.
You know, the purpose of them is to help maintain, heal, and regenerate tissues in our body, and this is happening constantly as we live each day.
Oh, wow.
If we didn't have stem cells, you know, we'd only live about an hour because we wouldn't have the ability to replace those damaged cells or repair, regenerate from any type of injury.
Wow.
So a good example is, let's say you fall down and injure your knee.
I just did that.
So,
I did.
Okay, so you're going to have an inflammatory response.
Yeah.
You're going to get inflammation in there. The immune system is going to go to work, and stem cells will be signaled to that area.
Oh.
And when they get there, the body's going to tell them what to do. So some of those stem cells will become muscle. They'll become ligament. They'll become tendon. They'll become skin. They'll become whatever tissues happen to be damaged as a result of that injury. So when someone has an injury that isn't healing the way that it should, for any reason, a stem cell injection can stimulate that repair process. And you can take stem cells from other parts of the body or even other people and stimulate that response.
Okay. Well, and we had another one.
Okay.
Kevin says he was diagnosed with, is it Paget's
Paget's
disease 3 years ago. Would stem cells help rid this for life? And how much cost is stem cell surgery? Well, it's not really surgery. So like,
it's not really surgery,
yeah.
right? So it's a tough question to ask without without actually seeing the X-rays and lab results and things like that. So what we do whenever somebody's contemplating some sort of stem cell therapy is we always do a free consultation. That allows us time to take a history, evaluate any X-rays or MRIs that a person may have, any blood tests, anything like that. And from there we can determine whether or not we can help them. Because certain cases you're not going to be helped, and we don't want to.
And you would tell them that.
Absolutely.
That's one thing
Absolutely.
I know about Dr. Joe. If he can't, he's not going to take your money.
Right. So, and then once we determine what treatment would be correct, then we can kind of come up with a cost. So stem cell therapies are not covered by insurance at this point.
Right.
But
there are ways to finance it,
Right.
payment plans, just like
Right.
everything else. So just
Right.
like it's like going to the dentist.
Right.
Very
and,
few people
and
have that.
it's much like LASIK. LASIK's been around forever. You've
right.
had hundreds of thousands of procedures. It's the best thing out there, but
it's not covered.
it's not covered. So
right.
this is
Okay.
very similar, and stem cell therapy is becoming more and more popular. You're getting more and more clinics out there providing, the regenerative medicine, which stem cells is a form of regenerative medicine. So, and the more and more it comes out, the more people are going to use it. So I don't know if insurance companies will ever cover it, but
right.
people are looking for alternatives. People,
Right.
they're tired of taking medications. They're looking for alternatives to surgery. They don't want to just cover it up.
Right.
Let's do something that's actually going to,
Make you feel
in some
better.
ways, yeah, and in some ways turn back the clock. heal up, slow down that wear and tear process.
That makes sense. I know we're going to get into a little bit more about what stem cell therapy treatment is and things like that, but we have another, I just wanted to say hi to, we've got a lot of people online. Hi Patrick, hi Jessica, hi Charles, who is also another CJ I went to school with. Hi Sandy, hi Lonnie, and Jeff, David. Okay, so Susan Scoville said, Dr. Joe is my amazing chiropractor. He's incredible. Thank you, Susan, for saying that. I've known Dr. Joe since he was 10, at least 10 years old. He's the best at everything he does. So when he told me about this, and we clearly have a great response. If you're somebody who has had struggles with pain, or you know of somebody, it doesn't matter. There's several things. We've been talking about MS and lupus and a few things like that. We'll get into that. But I wanted to also say, Kevin posted my hip, pelvic, and lower back region are early. Do you need me? Okay. Sometimes on live TV things happen, like the audio, but we usually have it covered. Do you need my help? Oh, okay. You hold that. I'll hold this, and we'll get it right back. Whoops. Okay, and we're still live. We're still here. All right, there we go. So sorry. We had a little blurb, but that's what happens on live TV. We got it fixed. Been taking anti-seizure meds for 50 plus years, Kevin had said. His hip, pelvic, and lower back region early on. So you're probably somebody who would want to call Dr. Joe.
Yep, definitely
and
do a consultation.
What number would they reach you at?
They can call 763-780-0112.
Okay,
and
great.
if it's if nobody answers, just leave a message. We'll call right back.
And the office is in Maplewood.
We've got one office in Maplewood and one in Spring Lake Park.
So Maplewood, Spring Lake Park. We are going to jump in and explain more of this. Thank you, Susan. Yeah, she said, amen. Yes, you get it. Barry, Steve, Margie, Flatley's online. We've got several again online. So if you're just tuning in or you've been with us, you may hear me repeat. I'm with Dr. Joe Biernat, who is talking to you about stem cell therapy and treatment and what that is. Where would you, I know we've had several questions and I wrote them down for you. Where do you want me to kind of start for you?
Maybe we can just talk about some of the functions of stem cells.
Yes. That was one question somebody emailed me, so absolutely.
I kind of break it down into four main functions of stem cells. It's obviously simplifying it greatly, but you've got anti-inflammatory, you've got immune modulatory, which means it'll help support proper immune function. You've got anti-apoptotic, which I'll talk about.
Okay.
And then there's
layman's
also,
terms, right?
Right. And then there's the antimicrobial. So, but I'll go through all those. The anti-inflammatory and the immune modulatory are extremely important. Whenever we injure ourselves or we have tissue that's damaged from lack of oxygen or aging, anything like that, we're going to have an inflammatory response. We're going to have an immune response.
Okay.
So stem cell therapy can block things like interleukin-1. Interleukin-1 is a chemical compound in our body that when it's released it's kind of like our body's 911 call. Oh. It's like our body raising their hand and saying, I've got an injury here, I've got damage, we need inflammation, we need the immune system to kick in. The stem cell will actually block that response. It will help fight that inflammatory response and help stabilize the area and start that repair process. You have things like tumor necrosis factor alpha, which people don't need to know, but it's a very pro-inflammatory chemical compound, and stem cells can help block that. Tumor necrosis factor alpha is also very heavily indicated in autoimmune diseases. So blocking these things,
like the MSs, the lupuses, some of those.
Rheumatoid arthritis, yes.
Okay.
So it has all of those different anti-inflammatory and immune modulatory components to it. You get things like vascular endothelial growth factor, which is going to help support what's called angiogenesis, which angiogenesis is when our body creates new vessels.
Wow.
You're going to get immune regulatory cells. You're going to get stem cell factor, which is going to help control those stem cells. You're going to get fibroblasts, which fibroblasts are the structural framework for our tissues, kind of like if somebody were going to lay a cement driveway and they put down that rebar before the cement goes down.
Right.
Fibroblasts are kind of like that framework for our tissues.
Interesting.
You're going to get nerve growth factor, which obviously helps nerve repair. You're going to get platelet-derived growth factor. The platelets help stimulate cell growth. They regulate cell division.
Wow.
You're going to get, stimulation of chondrocytes, which are cartilage cells. So you get all kinds of components in the stem cell that really stimulate that healing and repair process.
You can tell he knows what he's talking about. And we did get a few more comments and questions.
Sure.
Bick said, thank you for answering my question. I do not suggest people read Chiropractic at Your Own Risk, author Ralph Lee Smith, published by an American Medical Association. Well, yeah, okay. And then Kevin said, I'm in Rochester, not so far away. Thanks, Carla Jean. You're right. It's not far away. And, I was in Chaska, which was probably further away when I was seeing Dr. Joe and he was treating me. Hi, Dennis. Thanks for tuning in. Paul. Kevin said, thanks to Facebook for this happening. Might change my life and soreness and aches. You're absolutely right. If you are just tuning in, we're with Dr. Joe Biernat, who's talking to us, to those of you who maybe have pain or you know someone who's suffering from pain, talking about stem cell therapy and treatments. For those who are, hello Bridget and Pat who just tuned in. For those who are tuning in, I know we're going to get into some more of these questions. We've had several of you send questions ahead of time. Feel free to ask us questions online. Joe will answer those questions for you. But one of the things that I think a few people are wondering is, so who is a candidate for this? Like what different people that you might treat for different conditions, I guess. Yeah.
The more and more the research and the science, comes to the forefront, the uses for stem cell is really limitless. Any tissue that is damaged, any body function that isn't repairing and restoring itself, is potentially a person that could benefit from stem cell. So it's just a matter of getting those stem cells into where they need to be. So, if somebody's getting
like fibromyalgia, someone just asked that.
Potentially, yep. Again, it's always, we need to do a history and evaluation, but, there are people that they do stem cell for, a non-surgical facelift, or they'll do it for hair restoration. So at that point, you're just injecting under the skin. It may be a situation where they have an arthritic knee or an arthritic shoulder, then that injection is going to go into the joint. Then you get into some of the treatments for, say, rheumatoid arthritis or systemic lupus or something like that. Then you're looking at an intravenous application. So depending on a person's condition, the applications differ, the dosages are going to differ. So that's the whole reason that we do consultations for no charge. We need to determine if it is something that can help, and then if it is, we need to review all the medical information that we have and then determine what the best protocol is going to be.
Well, and we have several people online. Hi, Brian. We've right now, so obviously a lot of people suffer with varying pains, and we're talking about the stem cell therapy. We had several of you send questions ahead of time, and we've covered some of them. But Joe, is there I know I'd given you the list of a few of the questions. Is there one that you wanted me to answer from where we left off before?
People are probably wondering where they come from.
Yes.
Where the stem cells come
Where
from.
do the stem cells come from? And you talked about, some specifics here.
Yep, you've got some specific areas. There are, and again, this is simplifying it greatly, but there are basically two categories of stem cell. There are what are called autografts. So those are grafts that you take from the patient, concentrate them, and put them back in. So in a situation like that, they may harvest a little fat from the abdomen and concentrate that because there are stem cells in our abdominal fat. They may go into the hip bone and do a bone marrow aspiration from the hip. Concentrate that and re-inject it. Those are considered allographic. You may also do, that's an autograft. An allograft is where you actually get the stem cells from a donor, such as either from either amniotic fluid or umbilical stem cells. So,
and that's important, you said, right? The umbilical?
Very important. We prefer the umbilical stem cells because there's a large concentration of live cells in there. There's no procedure to extract them from the patient, so we don't have to expose them to, like a mini liposuction to get out the fat cells or stick a needle into their pelvic bone to get the bone marrow. And the other thing with the umbilical stem cells is that age is a factor.
Ah.
The older we get, the fewer stem cells we have. You know,
I probably have none.
I'm 47 years old. If you were to take bone marrow out of my hip, you probably have about 1 in every 400,000 cells, roughly,
Wow.
based on what the studies have shown, are stem cells. By the time you hit 70 or 80, it's probably 1 in about every 2 million.
Wow.
Whereas if you take umbilical-derived stem cells, you know, you're numbering 1 in every 50 or so.
So even
based
though
on the
I'm
studies.
50 years old, if I needed stem cell therapy or treatment, I would want it from the umbilical cord, right? Or not necessarily?
We feel like that's a better option, yeah,
Okay.
because of what's in it and the concentration of the actual live cells themselves. Now, the question we always get is, where do they get those cells? So, the extraction and the handling of umbilical stem cells is heavily regulated by the FDA, heavily
Okay.
tested. So it only comes from women who have a scheduled C-section.
Okay.
So about a month prior to, they'll be asked if they want to donate their
Oh.
umbilical cord, and then they'll go through
So that's
a
something
history.
for pregnant women to know about.
Correct,
Yes. Okay.
Yep, so they'll go through a medical history, social history, blood test.
Interesting.
And then if they agree to it, then the umbilical cord is processed based on the American Association of Tissue Banking.
Mm-hmm.
And then it's tested, it's sent to a third-party independent FDA-registered lab for testing for communicable diseases.
Okay.
Then they'll be sent out for finishing, so they'll remove the red blood cells out of there.
Okay.
And then again, sent to another third-party independent registered lab for sterility testing. And then
I
only
got to
after
interrupt.
that.
A
Yes.
couple people have said that phone number again.
Oh.
They've already sold. You've
That's
sold
good.
them.
That's
We'll
good.
get back into more info, but
So
yes.
it's 763
Yep.
780
Uh-huh.
0112.
763-780-0112. And I had someone say, "Great show, you guys." They're watching from
Appreciate it.
Florida.
Awesome.
But they're from Minnesota, so
Okay.
have a lot of connections here. And
Great.
another person said they'll pass this on to 1,600 friends, some in Hollywood also.
Nice.
Great.
We'll
Joe
take it.
Joe can do that because
I'll be
superstar. He's already, and then someone else just said, "Go Joey." Yeah. So they've obviously known you like I have. We
Sure.
called him Joey, but so Dr. Joe is somebody I've known for a very, very long time. Met him. He played hockey with my brother when he was 10 years old, the best at what he did then. Of course, he became an incredible baseball player as well, played for the Chicago Cubs and then the Saints when they won both championships. And then, of course, educated, went into and became a doctor, and now he's on the cutting edge with his Minnesota Joint and Spine Clinic. And if you're somebody with pain or you know somebody with pain, you want to stay tuned in, please feel free to ask questions. We've had several of you asking questions, but Dr. Joe is explaining stem cell therapy and treatment. Who's a good candidate? Really, just about anybody. We want to call Dr. Joe and go and at least talk to him about it.
Right.
And but we've been going through your various questions that were sent ahead of time as well as during the show. So we have jumped around a little bit. My
Sure.
apologies.
That's all right.
But yeah, I mean, we really, really appreciate. Hi. He was CJ from somebody I went to school with. His name is Charles. Interesting things, Carla, for sharing. CJ, not your brother, I know. Another CJ. But I graduated with this CJ. And the other CJ graduated with Dr. Joe. Someone said, Carla, you're the best. You're welcome, Kevin. If I can get you out of pain through Dr. Joe, we're just very happy to do that. He was kind of explaining, we've been talking a little bit about stem cell therapy and where and why the umbilical cord and where that comes from for the pregnant women and C-sections. Dr. Joe, what else do you think people need to understand?
The big question always is with the umbilical is it's only live healthy births.
Okay.
Planned C-section only.
Okay.
So I want to
So
make sure
no
that's
Planned
clear.
Parenthood.
Nope,
Yep.
none of that.
You don't have to worry about that.
Nope, none
Yeah,
of that.
but see, I know you. I've known him forever. The integrity and ethics of you and
Yes,
character.
yes.
So,
And
no question.
By the time we're ready to inject the umbilical stem cells into someone, it's been tested, no less than 4 or 5 times by various
Okay.
third parties and FDA registered labs. So it's
You know what? That's really
all
good to
healthy.
know too.
Very important stuff.
Yeah, I
Very
have.
important
Well,
stuff.
and his second dad is my dad, who is well known in the medical device industry of getting different products approved by the FDA, and so I know that it's just all it's things you want to be a part of. You want, if you're somebody who really just wants some relief, and I see so many people suffer from various pains, from MS to lupus to fibromyalgia to injuries, sports injuries. And I myself, I was walking out of a board meeting, it'll be almost 2 weeks ago, and stepped in one of those things that goes around newspapers, but it wasn't broken, but I didn't see it. Thank God I had things in my arms, and I didn't even fall slow. I went boom on my knee. And so, it's at age 50, I was like, I don't think I'm okay,
Right.
And not because I knew I didn't break anything, but I was like, did something break and did I fall?
Right.
And then the feeling after.
Yeah.
So that's...
After that inflammatory response or that immune response starts to really kick in. And the research is out there. There's a lot of research for all different types of, you've got the orthopedic uses for arthritis and joint injuries and tendon injuries and things like that. There's research on the autoimmune, there's cardiac research, there's COPD and emphysema. So the information is out there. People can search it online. So this is cutting edge stuff. This is the future of healthcare, and people they're looking for it. They're tired of just taking pills, and we've got an opioid problem in this country that's terrible.
Yes.
So this is a good alternative. It's not for everybody.
Right.
Not every condition can be helped, which is where not only do I do the consultations, but I also do some in-office seminars. So if people want to come, so
bring your 1,600 friends,
right.
Kevin.
Right. Well, I don't know if I can fit that many in the office, but
we'll do several. Yeah.
So I'll do some Saturday morning seminars. I have a half a dozen people, and we just very conversational, not sitting there and me
Let
lecturing.
me know let me know if you want to do the live show with some of those, so
Maybe
people
we
can
will.
watch online.
Yeah, that would be great. That would
and
be
more
great.
people can tune in.
Yeah.
Yep. Sorry, I didn't mean to hit you.
No,
with
that's
my,
okay.
Whoops.
That's okay.
I know we're just like, yeah. So if you're hearing my little puppy in the background, what's been kind of funny with her is she loves Dr. Joe, and you know how they say kids and dogs know? That's an example. My dog hates TV, hates being on any of these shows in our studio, but yet with Dr. Joe, she's been trying to get downstairs since we went on air because she wants to just be around him. So that right there, you should want to be around him and utilize his services. Yeah, no. What else, for those who are just tuning in, and I know we've jumped around, like I said, what else do they need to know about the stem cell therapy?
People invariably always have questions about cost.
Yes.
So with the insurance not covering it, we always take every case as an individual. So when they do come in and do a consultation, if it's someone we do feel we can help, we'll lay out a comprehensive plan, and we'll lay out costs and everything before before they would commit to anything. And it can be
no surprises.
No,
really.
absolutely.
Yeah.
Very transparent about that. And it could be as little as $800-900, but depending on the condition, could be where $7,000-8,000. It really varies depending on what treatment we determined is
best for their condition, or
indicated.
Touch on a few of the conditions that are kind of, I know there's several, but and each situation's different, so you would definitely need to have a consultation, so I need to have that disclaimer, but just a few people that may be thinking, well, I know someone who has.
Yeah, so some of the more common ones, I would say, knee arthritis. Obviously, you have a lot of people that are trying to avoid knee replacement.
Right.
Sometimes they have complications after knee replacement. Other types of joint injuries. There's, like I said, the intravenous applications for things like the autoimmune diseases. There are some clinics out there treating Lyme's disease.
Big one.
One of the things that stem cells are, they're antimicrobial, and they'll, for protozoa. Well, the bacterium that causes Lyme's disease is Borrelia burgdorferi, and that falls under that protozoal classification. So the antimicrobial benefit of stem cell will affect Lyme's disease. So and you have clinics out there dealing with neuropathy and all kinds of different things, plantar fasciitis. As science and research continue, and the stuff is coming out in volumes every day. The applications and the understanding of how stem cells work and what their true healing capabilities are. More and more information comes out every day. And there's spinal injury research. I know that the U of M does a lot of cardiac stuff in conjunction with Cedar Sinai in LA, and there's lots and lots of different things that are coming out every day. So you can almost take almost any condition, because it's just a simple process that the body does every single day, and you're just supporting it.
Will they get instant relief, or?
It depends. It depends. Sometimes, it may be within a day or so. Sometimes it may take some time, because one thing that you need, once the stem cells get in there, they need to replicate themselves. They need to set up that paracrine effect that we talked about, that expansion into our own, what they can call endogenous tissues, stimulating our own cells to do the work.
What about, a lot of people have that issue with their hands that type a lot. What's that?
Carpal tunnel?
Yes. Will it help that? It will. Okay. I know tendonitis, carpal tunnels. One question I got is blood type matching necessary?
It is not. Once the umbilical stem cells have been isolated, or the blood cell portion has been taken out, those proteins that would cause any kind of rejection or anything like that, they're no longer in there, so you don't have the blood type.
Okay, no, that's good. That's really, really good. And then we talked about some of the how they're harvested and things like that, and we've covered a few things. For those who, and we did have a few people just tune in just recently, is there anything that you think that you should repeat for those who did just tune in? I know we did talk about the conditions that it covers. We're talking with Dr. Joe Biernat from Minnesota Joint and Spine about stem cell therapy. It's for people who struggle with pain, or if you know somebody who has pain, you're going to want to give them a call, because we're talking just about anything and everything. Obviously, they would have to have a consultation, because every situation's different. Joe would be honest with them. He would set them up with a plan, just like you've done with all your other procedures and things that you work on. But Joe is all about health and wellness and doing things to help you, get out of pain and have some relief, so that you can function and live a happy, healthy life. Is there any, there's a few people that have just joined us too, but is there anything, oh wow, we've had several. Hi, Tracy, Jennifer, Joe, Bill, Jeff, and Scott. We're with Dr. Joe Biernat, and he is talking to us about stem cell therapy and treatment. For those of you who struggle with pain, or maybe you know someone with pain, we've had several of you ask questions ahead of the show. We've had several of you ask questions today. For those of you who want to reach Dr. Joe, you may have known his chiropractic clinic was called Specific Family Chiropractic, and they've expanded. They're evolving. Their new brand is Minnesota Joint and Spine, and you can reach him at 763-780-0112. And also he has a Facebook page, both with Minnesota Joint and Spine. They also have a Specific Family Chiropractic. I know somebody said they friended you. You can friend Dr. Joe Biernat. You can message him. He will get back to you if you have trouble finding those. You can through Carla Berlin, Around Town TV and Around Town Media. Or if you're watching directly on my page right now, please feel free to message me. I know how to find him. I've known Dr. Joe for a long time. I kept sharing his history with sports, because when someone's driven and determined, and they're a natural born leader at a young age, and he was the best at everything he did, but he was honest, there's that integrity, that's who you want to deal with. If you're probably somebody who's completely frustrated, when you're in pain, that pain can overtake you, and if you can't stay ahead of the pain, or if you are trying to with medicine, it's just masking it. It's not a resolution. It's not a solution, where Dr. Joe may be able to help you. Potentially.
This isn't the be-all, end-all, but it's just another option.
It's another option to at least explore. Give them a call. Make an appointment. Go in for a consultation. It costs nothing for a consultation to find out if he might be able to help you. One thing for sure, if he can, he's going to tell you. Yes, and he may have some other solutions. I think of, and this is just an example of a story, and I know we're going to keep it general, but we had a family friend who had a lot of pain in his foot, and this was before Dr. Joe was doing this. He went to specialists. He went to every doctor. He went to Dr. Joe. Dr. Joe found a piece of glass in his foot that all these other specialists had missed. That's just an example of how good he is at what he does. If he can't help you, he's going to tell you, but at least explore this option if you're someone in pain, or knows of someone in pain.
And if it's something that we don't treat or that we can't handle, we have a network of doctors that we work with. We can make the necessary referrals and make sure they get what they need.
Oh, see, that's huge. Let's see here. We've had several other people tune in, and we're very grateful to those of you who have. And of course, when this is done, if you've missed the beginning and you want to rewatch it, please feel free. We will have it posted in 18 different places where you're watching it right now, of course, but you'll be able to watch it even on our website. Is there, I know we went past a little bit on the time, but we've had so many people online. I knew that, I had a feeling, I told Dr. Joe ahead of time, we had so many people like it and send me questions, and we've been doing this live show since the end of November, and actually had the biggest response so far, both live and... So, we did get another wonderful presentation from Susan, and Just Worm said, "Hi, Dr. Joe, would this help chronic pain from genetic disorders? My son, who is 7, has hypermobile Ehlers-Danlos syndrome." Yep. Is there an age limit?
No, there's not. Obviously, it's something we would want to look into, and again, certain things aren't going to be helped by this. So, you know, if it's a situation like that, we want to look at all the evidence. And
so call him and make an appointment with his clinic, and at least, you know, have him look at your son and talk through it. He will tell you if you can't, but it sounds like it's worth looking into. And a few people are saying, you got many watchers, and great. And I know if some of you did just tune in, you can rewatch this. We will keep it posted. You can reach out to Dr. Joe directly. Did we cover everything that you had hoped for?
The only thing I would add is, just like with any medical treatment, anything you're considering doing, do your research.
Yes.
You know, the research is out there, the information is there. You know, if people reach out to me, I can help guide them to the research, because I always tell patients, you get one body, that's it. Always do your homework and make sure you know what you're getting into.
You told them that too.
For sure. Even with us, you know, don't just do it because we said so. Let's do the research and make sure we've got all the information that we need.
And I can tell you, when I was talking to Dr. Joe and asking him to be on the show and asking more information before he even sent me his information, before some of you started sending questions, I did my homework, and you're right. There's a lot of information out there. Yeah, and this has been around since what, 1930s?
Since the 30s, yeah. It's been around a long time.
It's just now.
The science is really, really catching up. We're starting to figure out what can be done, and the abilities of stem cells, and the very broad scope of treatments that are available. So and that continues. I mean, we still have a lot to learn about its function and how it exactly works, and you know, what are the abilities to heal. So
it'll just keep evolving, like chemos and cancers and all the other conditions and diseases out there. We just continue to advance, but what a cool, potential cool thing for you to,
and you look at something like LASIK. You know, 30 years ago, LASIK was very cutting edge and experimental, and boy, should I do this, should I not? And now it's very much mainstream.
Absolutely.
Thousands of treatments every day, and stem cell therapy is becoming very much like that. Very much like that.
Well, and LASIK, he mentioned that it's changed my life. I was going to have to pull myself off TV because I couldn't always see the teleprompter and the monitor. And I saw, they only predicted I would see 2030. I saw 2020 and almost 2015 in one eye. Years later, I started to have some issues, and it evolved into... it evolved into where I had to have the PRK, where I had one eye, and I just did that last summer, same thing. So those are newer things out there too. And so now we're talking to you, though, about with Dr. Joe about stem cell therapy and treatment for pain. If you suffer from pain, or if you know of someone who does, we know the opioid is a huge problem. People are addicted to pain meds. In fact, when my mom was diagnosed with metastatic breast bone cancer and had to start some of those, that was her fear, that she would become addicted. So and we wanted her to stay ahead of her pain. There's so many different conditions and ages and things. Give Dr. Joe a call. You can ask privately in messaging. I know there's a lot of people. Hi to David, Jamie, Michelle, Wilson, Neil, Dan, Barbara, Dana. We appreciate all of you joining. Before we close the show, unless there's some things you want to reiterate, because we do have a lot of people online, but I think we did cover it all. Again, one more time, to reach you at Minnesota Joint and Spine, and they have evolved into this. They were Specific Family Chiropractic, so it is the same company, so you can reach them through there as well. But in addition to your phone number, which is 763-780-0112. Okay, and they're in Maplewood and Spring Lake Park.
Yep.
2 offices.
Yep.
And can they email too?
Yep, they should be able to.
Through the website, through the
website.
Facebook page or the website, you
Yep.
can email directly. Give them a call. You have nothing to lose than to meet with them and find out if this is for you. And they'll ask you questions. They won't waste your time to drive over there just in case.
No.
I really appreciate you tuning in to this stem cell therapy and Dr. Joe edition of Around Town TV. This is our 228th show in 16 years. We are the longest airing television community showcase, known as Minnesota's lifestyle and business experts. It's a pleasure to feature some of the best kept secrets and businesses around town. And what a pleasure it is, an honor for me to have Dr. Joe, because I've known him since he was 10 years old. I know his character. I know his integrity. I know he's the best. So give him a call and find out if they can help you. If you need to private message us, go ahead. Otherwise, please tune in next Tuesday evening live Central Standard Time right here on Around Town TV. Thanks again. Bye-bye. It should be. You're good. I'll just make sure.